Hi, my explanation between the difference of left-sided heart failure and right-sided heart failure. Looking at left-sided heart failure, the most common cause of left-sided heart failure is it is an increase of pressure in the left ventricle, and therefore it can be caused by a couple of things. So, idiopathic essential primary hypertension is the number one cause, and if it is uncontrolled and untreated, therefore it could lead to left-sided heart failure. So that ventricle enlarges and the tissue hypertrophies, and therefore decreases the contraction of the ventricle, as well as it causes issues with the mitral valve. So, therefore, you have a decrease of contraction, as well as you have an issue with the mitral valve. Therefore, the mitral valve does not close properly, and it regurgitates back up into the left atrium, and it goes into the pulmonary vein, into the pulmonary system. Therefore, you have clinical manifestations of your patient having shortness of breath, dyspnea on exertion, and you'll hear coarse crackles in the lungs, and they begin to retain fluid. It sets them up for a good risk factor of pulmonary edema. Looking at the common causes is injury, left-sided heart failure, as well as uncontrolled hypertension, as I said as well. Right-sided heart failure usually is the cause or is caused by left-sided heart failure. So it's non-treated left-sided heart failure. Therefore, you have clinical manifestations of the backup from the lungs actually into the right side of the heart. Therefore, you have an increase of fluid going down the peripheral system. So therefore, you have JVD, you have hepatomegaly, you have splenomegaly, you have generalized edema, independent edema in that patient. So right-sided heart failure is a complication of untreated left-sided heart failure. And that's the difference between the two.